Eden, fifth floor. Greg speaking. Oh, hey. Jensen, how you doing? Oh, I see. You're going to be late? Yeah, I got the assignments right here. They're posted already. It looks like you'll be working with Brian. So I guess I'll just tell the nursing director and Brian that you'll be late, I guess. All right, bye. Hey, Nurse Brian, I just wanted to say that your CNA, Jensen, he's going to be half an hour late this morning. So.
Shit. You know, he's late all the time. You know, how am I supposed to get my work done if my CNA's late all the time? You know, from what I hear from the night charge nurse, Mr. Adams painted his walls brown. I'm not going to clean that up. I'm an RN. I'm not a CNA. Hey, Jensen's going to be late again, so I'm going to go talk with them. I'll let him know who's boss.
Oh, okay, well, Brian, I've already been informed of the situation, and I'll be talking to Jensen about this. It's not your job to manage or discipline the staff. Your priority is patient care. For the meantime, I've asked CNA James to help you out with your patients today until Jensen arrives, and you can also ask the charge nurse for additional help if you need it.
Whatever. Hey, nice of you to show up. My alarm didn't go off this morning. Mm-hmm. Okay, I'm done. Time to go home.
Jensen, can you come into my office, please?
Yeah.
Okay. Jensen, I need to talk to you about some discrepancies in your punctuality. We can talk about them now, or we can wait until tomorrow so you can contact your union representative so they can be present with you during the meeting. It's up to you.
Fine. Right now's fine.
Okay. Oh, okay, well, Jensen, this is Mr. Yong Kim. He's the hospital representative, and he needs to be present during, this meeting.
Nice to meet you.
Okay, so now let's go over your time cards. Your time cards show that, you were late on Monday. I'm sorry, you were absent on Monday, April 6th, and then you were late the following Monday, April 13th, by half an hour, and then absent again the following Monday, the 20th, and then late again on 4/27, Monday, by an hour, and then today, Monday, May 4th, you're late by an hour. You were provided, with the policies of our hospital regarding absenteeism and, tardiness from HR when you were first hired. All these incidents, these past 5 Mondays, is there something going on, over the weekend that's making it hard for you to come in on time, on Monday mornings?
Well, nothing personal, but I like my job, and I know the policies. But you understand, I get scheduled to work with Brian all the time Monday. I hate him, he hates me. He's mean, he's bossy, and he makes me do all the dirty work. And you don't understand. He's not even good to look at, And I get paid, deducted every single time, and I don't mind. I love my job, but I can't work with Brian. I just can't.
Okay, I understand. I hear your frustration, Jensen, and I'm going to have to talk with Brian as well, about helping you out more. But the fact remains that you have been consistently late. So this is a verbal warning that I'm giving you, and if we can't find a solution that gets you to work on time, I'm going to have to discipline you.
I understand.
So let's go over some of the hospital policies. Under the counseling and disciplinary guidelines, it states that tardiness may result in disciplinary action if any of the following infractions occur: 2 incidents of tardiness in 1 week, 3 incidents of tardiness in 1 pay period, 4 incidents of tardiness in 2 consecutive pay periods, 6 incidents of tardiness in 3 consecutive months. Any pattern of tardiness of an employee which in management's judgment may interfere with the department's operations may also be a basis of disciplinary action. And then also, under the accelerated discipline for absenteeism and tardiness, it says that where there are parallel or overlapping incidents or patterns of absenteeism and tardiness, the disciplinary action may be accelerated. So this one here regarding the patterns of tardiness applies to you. And also this one about the parallel or overlapping incidents or patterns of absenteeism and tardiness applies to you and states that, disciplinary action may be accelerated. I really wish that you'd come to talk to me earlier about your problem, because it's just gone on too long and it's interfering with, with the care that we're providing to our patients. Instead of giving a written warning the next time you are late or absent, you're going to be suspended, and if it happens again, and after that, you're going to be terminated. So I'm putting you on probation for 3 months, during which this time the accelerated discipline actions will be in place. And if you agree to come and talk to me about your frustrations and you can prove that you can adhere to the policy during the probation period, I'll talk to Brian about his attitude toward the staff.
Okay, well, that sounds reasonable, and sorry for coming in late and tardy all the time, But you understand, working with Brian is really pain. But I thought that I had to come speak to Brian personally about my feelings. So now that I know I can talk to you, next time I will.
You're a valuable employee, Jensen, and as a manager, I'm here to help the staff with their problems such as these, and my door is always open for you.
Okay.
Hi, Jennifer. You wanted to see me?
Yes, thanks for coming in to talk to me, Brian. I got a joke for you.
Okay.
What do you get when you cross a brown chicken and a brown cow?
What?
Brown chicken, brown cow. Okay, anyway, on a more serious note, Brian, I just wanted to bring to your attention that some of the staff here are intimidated by you, and they're having trouble performing to their best because they feel that you don't respond to them. You don't respect them, and that you always give them difficult tasks. How would you feel if you're the only one, being given assignments that you didn't like?
Let me guess. It's Jensen, huh? He's complaining about me. That guy is such a slacker. He needs to get the worst assignments until his behavior changes and he quits showing up late.
Okay, well, Jensen's tardiness, I know, has become an increasing problem, and I've already dealt with that. However, his frustration has escalated, and that's what I want to talk to you about. I think it may make things work more smoothly if you remembered, that the assistants are important assets, to the hospital. My job here is to make things run more smoothly, and I'd really like the relationship between the CNAs and the RNs to be professional and respectful. Jensen and I have come up with a plan that will get him to work on time. Do you think you could come up with an idea that would make your relationship with Jensen stable?
Well, I guess I do a lot. I ask a lot of the CNAs, and I guess I don't show a lot of appreciation for the hard work they do.
As an RN, Brian, you're in a leadership role, and I don't want to tell you what to do, but I need to remind you that as a leader, you need to lead by example. Maybe you could try to show the staff that you're willing to do the hard job and support their hard work as well. And show them that, just as they are there for you, you're there for them as well.
Oh, yeah, that sounds fair. This tension between Jensen and I, it's gone on long enough. I see where you're coming from, and I will. I'll try to make an effort to do my part as a leader.
Okay, sounds good, Brian.
Okay.
Hey, you out there, get in here, clean my room. You better bring a mop.
I got it.
Hey,
What?
this code brown's mine.